Good morning/afternoon, everyone. Today I want to talk about an essential aspect of diabetes management: how to use an insulin pen correctly. Whether you're newly diagnosed or helping a loved one, understanding how to administer insulin with confidence can greatly improve quality of life. Insulin pens are designed to make life easier for people with diabetes. They're portable, discreet, and simple to use, but like any medical device, proper use is essential for safety and effectiveness. In Insulin walk you through 10 important steps to ensure you're using an insulin pen the right way. By the end of this talk, I hope you'll feel more empowered to take control of your diabetes care. Let's dive in. Understanding your insulin prescription is the foundation of effective diabetes management. Here's why this step is critical and how to approach it. I know the types of insulin. Insulin comes in several forms, each with a unique action. Time. Directing insulin begins working within 15 minutes and peaks within 1-2 hours. Used for mealtime blood sugar control. Short-acting insulin takes 30 minutes to start working and peaks in 2 to 3 hours. Intermediate-acting insulin begins working in 2-4 hours, peaks at 4 to 12 hours, and lasts up to 24 hours. Long-acting insulin provides steady blood sugar control throughout the day or night, usually without a significant peak. Maybe understand your dosage. Your healthcare provider prescribes a specific number of insulin units per dose. This dosage may vary based on factors such as your blood sugar readings, carbohydrate intake, physical activity level, time of day. London is about to be the hub centre for an upcoming social conference in London. Knowing how to adjust doses safely, if recommended, is also crucial. Be aware of insulin on board, IOB. Insulin can remain active in your system for hours after injection. Understanding how long your specific insulin works helps prevent hypoglycemia, low blood sugar, caused by overlapping doses. Timing is everything. The timing of your dose is as important as the dose itself. Rapid-acting insulin should typically be taken just before or immediately after meals. Long-acting insulin is often administered at the same time each day. For consistency, work with your doctor to create a schedule tailored to your routine. Storage and handling. Insulin must be stored properly to remain effective. Keep unopened pens refrigerated between 36 DEGF and 46 DEGF, 12 DC and 8 DEC. Open pens can usually be stored at room temperature for up to 28 days, but always refer to the specific instructions for your brand. Understand potential side effects. Know the potential side effects of insulin use, such as hypoglycemia, weight gain, or localized reactions at the injection site. Being informed prepares you to act quickly if issues arise. Keep an updated prescription. Insulin doses and types may change over time as your diabetes progresses or as your lifestyle evolves. Regularly consult your healthcare provider to ensure your prescription remains appropriate. Ask questions. Don't hesitate to ask your doctor, pharmacist, or diabetes educator for clarification about your prescription. Questions to consider. Does the diagnosis give you hope at least some time between the visits to their office? What shall I do if I miss a dose? Can I adjust my dose for exercise or illness? Are there interactions with other medications I'm taking? By fully understanding your insulin prescription, you ensure proper usage and better blood sugar control, laying the groundwork for effective diabetes management. Ensuring that your insulin pen is in proper working condition is essential for safe and effective use. Here's a detailed breakdown of what to check and why it matters. Inspect the pen for physical damage. A warning before you use it. Examine the pen for any visible signs of damage, such as cracks, leaks, or malfunctioning parts. A damaged pen can result in inaccurate dosing or leakage of insulin. Verify the insulin type. Double-check the label on the pen to confirm it's the correct type of insulin for your prescribed dosage and timing. Mistaking one type for another, using rapid-acting instead of long-acting typing instead of blood sugar imbalances, or emergencies. Check the expiration date. Insulin loses its effectiveness if it is expired. Always check the expiration date printed on the pen or packaging, and never use expired insulin, as it may not control your blood sugar levels adequately. Inspect the insulin appearance. Clear insulin. For rapid-acting and long-acting types, ensure the insulin is clear and free of particles. If it looks cloudy, discolored, or contains debris, do not use it. Cloudy insulin. Some intermediate-acting insulins, NPH, are supposed to appear cloudy. Gently roll the pen between your palms to mix it evenly, ensuring it looks uniformly milky before use. Check the dosage dial. Turn the dial to ensure it moves smoothly and correctly. If the dial feels stuck or does not align properly with the numbers, the pen might not function correctly. Ensure the cap is secure. The pen cap protects the insulin from exposure to light and air, which can degrade its potency. Always ensure the cap is securely in place when not in use. Confirm proper storage. Insulin pens must be stored according to manufacturer instructions. Unopened pens. Keep refrigerated between 36 DGF and 46 DGF, 2 DGC and 8 DGC. Opened pens. Store at room temperature, 15 Noran DGF to 86 DF or 15 DGC to 30 DFC. But away from direct heat or sunlight. If the pen has been exposed to extreme temperatures, do not use it. Look for air bubbles. Inspect the cartridge for air bubbles, as these can interfere with accurate dosing. If bubbles are present, prime the pen by expelling a small amount of insulin until the bubbles are gone. Check the pen's insulin level. Ensure there is enough insulin in the cartridge for your dose. Most pens have a clear section where you can see the remaining insulin. If there's not enough, you'll need a new pen. Test before first use. Spoon. If it's the first time you're using a new pen, follow the priming procedure, typically dial up 2 units and press to release insulin to make sure the pen is dispensing correctly. By routinely checking your insulin pen before every use, you reduce the risk of errors and ensure that your treatment is effective and safe. Before administering insulin with an insulin pen, it's crucial to gather and prepare the necessary supplies. Proper preparation ensures a smooth and safe injection process, reduces the risk of complications, and minimizes errors. Here's a detailed breakdown of what to prepare and why each step matters. 1. Insulin pen. Ensure you have the correct insulin pen for your prescribed dose and type of insulin, rapid-acting, long-acting, or mixed. Verify that the insulin pen is in good condition, not expired, and contains enough insulin for your dose. 2. Use a new needle for each injection. Reusing needles can dull them, causing more pain, and increase the risk of infection or tissue damage. Check that the needle packaging is intact and sterile before attaching it to the pen. 3. Alcohol swabs. Have alcohol swabs ready to clean the injection site and the rubber stopper on the pen if necessary. Cleaning reduces the risk of introducing bacteria into the injection site, preventing infections. 4. Sharps disposal container. Use a designated sharps container to safely dispose of used needles. Never throw needles directly into household trash, as they can pose a safety hazard. Ensure the container is puncture-resistant, clearly labelled, and complies with local regulations for medical waste disposal. 5. A clean, well-lit workspace. Choose a clean area to lay out your supplies. A clutter-free and hygienic environment minimizes the risk of contamination. Ensure the space is well lit to clearly see what you're doing, reducing the likelihood of errors such as incorrect dose styling or needle attachment. 6. Optional comfort supplies. If you're sensitive to injections, you might want a cold pack to numb the area before injecting. Keep a small bandage nearby in case of minor bleeding after the injection. 7. Check for emergency supplies. If you're prone to hypoglycemia, low blood sugar, keep glucose tablets, juice, or a small snack nearby in case your blood sugar drops unexpectedly. Have your blood sugar monitoring device ready to check your levels before or after the injection as instructed by your doctor. Evidence-based intervention. 8. Wash your hands. Wash your hands thoroughly with soap and water before handling your supplies. This step helps prevent contamination of the needle, pen, or injection site. Dry your hands completely to ensure a secure grip on the insulin pen and needle. 9. Verify the dose and timing. Double-check your prescribed insulin dose and the timing of your injection to ensure you're following your healthcare provider's instructions. If you use multiple types of insulin, make sure you're preparing the correct pen for this specific dose. 10. Be mentally prepared. Take a moment to calm your mind and focus. If you're feeling anxious or rushed, it's easier to make mistakes. This is a big deal. Review the steps in your mind or checklist to feel confident before beginning. Here we go. Review the steps in your mind or checklist to feel confident before beginning. By preparing all the necessary supplies in advance, you ensure a smoother, safer, and more efficient injection process, reducing the risk of errors and enhancing your confidence in managing your diabetes. Attaching a new needle to your insulin pen is a critical step in ensuring safe, accurate, and comfortable insulin delivery. Here's a detailed guide to this process and why it's essential. 1. Choose a new needle. Always use a new, sterile needle for each injection. Reusing needles can cause pain. Dull needles may hurt more during insertion. Infection. Reused needles can introduce bacteria to the skin. Clogging. 2. Inspect the needle packaging. Check the needle packaging to ensure it is sealed and sterile. Avoid using a needle if the packaging is damaged or opened. Other luxury items cost more on the entire shop. 3. Remove the pen cap. Take off the cap of your insulin pen to expose the cartridge. Ensure the pen's rubber stopper is clean and intact before attaching the needle. 4. Attach the needle securely. Line the needle base with the tip of the insulin pen. Screw the needle onto the pen by twisting it clockwise until it's firmly attached. Some needles click into place instead of twisting. Follow the specific instructions for your pen model. Ensure a snug fit to prevent leaks during injection. 5. Remove the outer needle cap. Pull off the large outer cap covering the needle. Save this cap, as you'll need it later to safely remove and dispose of the needle. 6. Remove the inner needle cap. Gently pull off the smaller inner cap to expose the needle. This step prepares the pen for priming and injection. Be careful not to touch the needle to avoid contaminating it. 7. Inspect the needle. Look for any visible damage, such as bending or deformity. If the needle is damaged, replace it with a new one before proceeding. Damaged needle ensures accurate dosing and minimizes discomfort during injection. 8. Keep the needle sterile. Avoid touching the needle or letting it come into contact with unclean surfaces. Contamination can increase the risk of infection or injection site irritation. 9. Prime the pen. After attaching the needle, it's essential to prime the pen by dialing a small dose, typically 2 units, and pressing the button until insulin appears at the needle tip. Priming removes air bubbles and ensures the pen is delivering insulin correctly. 10. Be aware of needle length options. Insulin pen needles come in various lengths, typically ranging from 4 meters to 12 meters. Consult your healthcare provider to choose the best needle length for your needs, considering factors such as body composition, and injection site preference. Shorter needles are generally more comfortable and effective for most people. Why this step is crucial, and attaching the needle properly ensures accurate insulin delivery. A secure connection prevents insulin leaks and ensures the full dose is administered. The chief responded to brain's contamination. Using a new sterile needle minimizes contamination. Comfortable injections. A straight, sharp needle causes less pain and tissue damage. By following these steps, you can confidently attach the needle to your insulin pen, ensuring a safe and effective injection process every time. Priming your insulin pen is a critical step to ensure that the pen is functioning correctly, delivering accurate doses, and removing any air bubbles that could interfere with insulin administration. Here's a detailed guide explaining why and how to prime your insulin pen. 1. Priming involves expelling a small amount of insulin, usually 2 units, through the needle before administering your dose. This step ensures the pen is ready to deliver the correct amount of insulin without air pockets affecting the dose. 2. Why is priming necessary? That packet must be re-primed. Removes air bubbles. Air bubbles in the cartridge or needle can reduce the amount of insulin delivered, leading to inaccurate dosing. Tests the pen's functionality. Priming confirms that the insulin is flowing properly through the needle. Prepares the needle, ensures the needle is filled with insulin, avoiding gaps or interruptions during the injection. Prevents overdose or underdose. Skipping priming can lead to errors, such as injecting too little or too much insulin. 3. Steps to prime the pen. Attach the needle. Ensure a new sterile needle is securely attached to the insulin pen. Dial a small dose. Turn the dose dial to 2 units, or the amount specified by the manufacturer. Some pens have a designated priming icon on the dose dial. Refer to the pen's instructions for proper guidance. Hold the pen upright. Hold the insulin pen vertically, with the needle pointing upwards. This position helps air bubbles rise toward the needle, ensuring they are expelled during priming. Lightly tap the insulin cartridge to dislodge any air bubbles and move them toward the top of the pen. Press the injection button. Push the injection button firmly until insulin appears at the needle tip. Look for a steady droplet of insulin. This confirms that the pen is primed and ready for use. Repeat if necessary. If no insulin droplet appears, repeat the priming process by dialing another 2 units and pressing the button again. It's difficult. If the pen still does not release insulin after multiple attempts, check for issues such as a clogged needle or an empty cartridge. Replace the needle or pen if needed. Cover the pen with full tip. 4. Verify the priming process. Ensure a visible droplet of insulin forms at the needle tip. Without this droplet, the pen may not be dispensing insulin properly, leading to ineffective blood sugar management. 5. Dispose of primed insulin safely. The small amount of insulin released during priming can be wiped away with a tissue or allowed to dissipate. Avoid priming directly onto surfaces where insulin residue may accumulate. 6. Be mindful of frequent priming. Regular priming consumes a small amount of insulin, which may affect how long your pen lasts. Always check the insulin level in the pen to ensure there is enough for your prescribed dose after priming. Common priming mistakes to avoid. Skipping priming. This can result in air being injected instead of insulin, reducing effectiveness. Priming at an angle. Always hold the pen upright to ensure air bubbles are expelled, forgetting to check the droplet. If no droplet appears, insulin delivery may be compromised. Not repeating priming if needed. If the first attempt doesn't work, repeat until a droplet appears. Why this step is important. Priming ensures accurate dosage, removes air that could cause an incorrect dose. Sedan. Proper needle functionality confirms insulin flows through the needle without blockages. Effective blood sugar control provides confidence that the full prescribed dose is delivered. By consistently priming your insulin pen before every use, you can feel confident that you are administering insulin safely and accurately, optimizing your diabetes management. Setting the correct dose on your insulin pen is a crucial step in managing your blood sugar levels effectively. Properly dialing in the prescribed dose ensures you receive the exact amount of insulin your body needs. Here's a comprehensive guide to help you navigate this step with confidence. 1. Verify your prescribed dose. Double-check your prescription or your doctor's instructions for the exact dose you need to administer. If you're taking multiple types of insulin, contributor, rapid-acting and long-acting, ensure you are using the correct pen for this specific dose. 2. Inspect the dose dial. Ensure the dose dial is functioning correctly. It should turn smoothly and click clearly as you adjust it. If the dial feels stuck or moves erratically, check the pen for damage or malfunction. Replace the pen if necessary. 3. Check the remaining insulin. Look at the insulin cartridge window to ensure there is enough insulin for your full dose. If there isn't enough insulin, you'll need a new pen or cartridge. Do not try to combine doses from different pens. Instead, use a fresh pen to administer the full dose. 4. Dial the dose. Turn the dose dial to your prescribed amount. The numbers on the dial should align clearly with the dose indicator window. Be precise and ensure the correct number is displayed. Even a small deviation can affect your blood sugar control. 5. Correct mistakes carefully. If you accidentally dial the wrong dose, do not panic. Simply turn the dial backward or forward to adjust it to the correct number. Avoid pressing the injection button while adjusting the dose, as this may release insulin prematurely. 6. Understand your pen's limitations. Some pens have a maximum dose limit for a single injection. If your dose exceeds this limit, consult your doctor for instructions or use a second injection. Be aware of the specific features and limitations of your insulin pen. 7. Ensure visibility of the dial. Hold the pen at eye level while dialing to clearly see the numbers and avoid setting the wrong dose by mistake. Adequate lighting can help you see the dose indicator window more clearly. 8. Double-check the dose. Before proceeding, review the number on the dose indicator one more time to ensure accuracy. If you are new to using insulin pens, consider using a checklist or asking a caregiver to verify the dose. 9. Account for priming. Remember, the dose you set should not include the units used for priming. Always prime the pen first and then set the dose. 10. Be mindful of dose adjustments. Adjustments to your insulin dose should only be made under the guidance of your healthcare provider. Avoid guessing or changing your dose based on how you feel without consulting your doctor, as this can lead to blood sugar fluctuations. Why this step is crucial. Properly setting the correct dose ensures accurate insulin delivery, avoids underdosing, leading to high blood sugar, or overdosing, risking hypoglycemia. Consistency in treatment helps maintain stable blood sugar levels, reducing the risk of complications. Confidence in management. Knowing you've set the right dose gives peace of mind and fosters good habits in diabetes care. By taking the time to carefully set your dose, you ensure that your insulin therapy is both effective and safe, contributing to better overall diabetes management. Re-secure your insulin pens and always have a hurdle in your bag. Common sites include the abdomen, thighs or upper arms. Rotate injection sites to avoid developing scar tissue. Lenum inject. Nel. Clean the injection site with an alcohol swab, pinch the skin, insert the needle at a 90-degree angle, or 45 degrees if you're lean, and press the button to deliver the dose. Wait before removing the needle. Keep the needle in place for about 10 seconds after pressing the button to ensure the full dose is delivered. Dispose of the needle safely. Remove the used needle, place it in a sharps container, and recap the insulin pen for storage. Then press the reset button so that the sharp is securely placed. Conclusion: using an insulin pen is a straightforward process that, when done correctly, helps maintain optimal blood sugar levels and prevent complications. Always consult your healthcare provider if you have questions or concerns. Remember, the more confident you are with these steps, the better you'll manage your diabetes. Thank you for your attention. If you have any questions, feel free to ask.